So we are live on Facebook and we are now live on, on YouTube as well. So we can get started. Let me do a quick introduction. So good evening, everyone. Thank you for joining today. We are 2 days ahead for World Patient Safety Day, but it's better to be early than late. And the theme this year that WHO has set out is essentially focus is on safe maternal and newborn care. We thought we would focus on why it's important for women to be better informed about making the right choices, as well as, be advocates of themselves as far as childbirth is concerned. Let me quickly do a quick introduction. Most of you know PatientsEngages. We are an online platform which believes that lived experiences of people with chronic conditions is important. And we do believe that if people are informed about health conditions or even basic health topics, they will be more engaged with their own health and they will be empowered to make better decisions. We cover a wide range of conditions which you can find on our social media platforms, on our website, etc. We are very privileged today to have with us, let me introduce our panelists. We have Dr. Evita Fernandez. She is a fellow of the Royal College of OBGYN, UK, and she's now chairperson of Fernandez Foundation in Hyderabad. She strongly believes in the need to empower women to make choices, especially with regard to issues surrounding birth. And one of the areas that she's really actively working at the moment is on midwifery. She's spearheading a program to build a cadre of professional midwives who are vital in the care of low-risk pregnant women. We also have with us Dr. Shital Raval or Dr. Shital Patel, who is a general practitioner who did her undergraduate studies in the US and attended medical school in the UK. She's a lactation counselor and she's also a medical editor for PatientsEngages. She's been working in India to promote public health and worked with various local and international NGOs. A very strong believer of awareness around anti-tobacco and also very passionate about women's health especially as far as breastfeeding and lactation is concerned. Quick reminder to our viewers that this is not replacing a personal consultation, so please do consult your doctor for specific medical issues. This session is being recorded, so if you're watching us on the YouTube or Facebook live stream, you can post your questions on the live feed. If you have an experience to share, you can write into us at editor@patientsengage.com. And as always, you can follow us on our Instagram, on our Facebook page, YouTube, Twitter, and the website is www.patientsengage.com. So let me get started because I think we have a lot of ground to cover. As I said, we were just discussing, I think about 67,000 babies are born in India each day. But for most women, this childbirth is still a very frightening experience. There's fear, there's anxiety. And this year, WHO has urged stakeholders to focus on safe and respectful childbirth. So we will talk to Dr. Evita Fernandez and Shital as to what that means. And also, yes, we recognize that fewer women are dying of childbirth, but is that enough? What are the issues that women are facing and how can they be better prepared to make childbirth a better experience? So thank you for joining us, Dr. Evita and Dr. Shital.
Thank you for having us.
Thank you. So let's start with, typically when we look at patient safety, we don't think of childbirth. We think of other issues of hospitalization, sepsis, or surgeries gone wrong in terms of, knee replacements, hip replacements, but somehow most people don't think of maternal and newborn health as an issue of patient safety. Why do you think it is a good thing to focus on that as a topic under patient safety?
Thank you. Thank you, Aparna, for that question. And to be honest, as an obstetrician, I'm absolutely delighted that for this year, WHO focused on maternal and newborn care and added a line, says, act now for safe and respectful childbirth. The statistics, we lose about 800 mothers every day due to childbirth. And 46% of maternal deaths happen during childbirth. So not only are you losing mothers, but during childbirth, 40% of babies are born stillborn because of lack of skilled care during labor. So you're looking at the next generation that you're losing out on. Okay, so that's just connected with childbirth alone. And just the burden of risk and harm that COVID-19 has now, impacted, because during any calamity, we know whether it's earthquake or man-made calamity, it's the women and children who suffer the most. And that has been widely seen through the pandemic. So I'm not surprised that WHO decided to focus on women and the newborn. It's also calling for an action because in India, I can tell you that the government asked for institutional births, and we've reached about 80% of our mothers come into hospitals. And they've also offered financial incentives. So the volume has increased by 30-40% in some states. And the infrastructure was not able to cope with this. So you've got a very tired staff, stretched beyond limits, no beds for mothers, and not enough skilled care. So with the hope that it would reduce maternal deaths, yes, there has been a tremendous reduction in maternal deaths in India, but the morbidity, and when you talk about morbidity, you're looking at long-term effects because mothers are traumatized with disrespect, abuse, violence that happened. So there's fear, there's mental health issues that have arisen. And COVID has increased all of this because of, again, the lack of access to care because of the lockdown, the lack of access to contraception. So you've got unintended pregnancies that have happened. So you can understand why it's so important. Mother and newborn health has been brought to the forefront.
Thank you. And you talked of some of the issues that are affecting mothers, but if you can elaborate a little bit more, especially in the context of rural and urban settings in India, what are the issues that affect maternal and newborn health? Yeah. Well, and that's first Dr. Evita and then Shital.
In the urban setting right now, Aparna, there's been a growing epidemic among the reproductive age group, particularly the ones who are working mothers, an epidemic, let's say, of obesity, reduced physical activity, diabetes in young people, and the stress of city life and whatever jobs, so hypertension. So women are entering pregnancy without being aware that they are actually carrying these medical problems and are at a higher risk.
Right.
Secondly, depending on the socioeconomic status, you could be in an urban setting, but you could be in an urban slum. And so not being able to access care, particularly if you're the migrant population, because you don't have a number anywhere, you're not on the radar. And that adds to the problems. If you're a nuclear family, no help, your nutrition, your diet, it may be poor because you're eating junk food, you're on the run all the time. So the kind of women that enter pregnancy, not particularly healthy. So that's one of the problems we're facing. And it's so important that they actually seek help before they get pregnant. In the rural setting, it's lack of transport, lack of skilled care, lack of awareness, a lot of myths that women believe in. And I think that's, again, gotten worse with the pandemic, the effect of all this,
Right.
I've just put this in a nutshell. Yeah.
Right. Yeah. Thank you.
Yeah, I totally agree with Dr. Evita. For the rural areas, lack of timely medical care is also a big issue.
Sorry, can you speak up a little? Or
okay.
Yeah.
Okay, I'll just. So yeah, as Dr. Evita said, in the rural area.
Can't hear you.
No.
Hello?
Yeah.
Go ahead.
Okay.
Yeah.
All right. Sorry about that. So I was just saying, like Dr. Evita said, that lack of timely medical care is also an issue. And that became an issue both in the rural areas as well as the urban areas, right? Because the hospitals were so overworked and packed.
Right.
Also, there continues to be a lot of family pressure around, hurried pregnancy after the wedding itself. And that happens through, the country, mostly conservative families. Then the demand for a male child is still very much there. Multiple pregnancies, auspicious birthdays, the lack of knowledge regarding birthing options on its own. So these things happen even in the urban areas. Regarding birthing options, there is a lot of peer pressure and medical fraternity pressure on the mother to go for painless deliveries. So again, that is something that we see a lot in the cities, in the metro cities as well. So just a few more of those influencing factors that I think just add up when we talk about pregnancies and births.
Yeah. Right. Thank you. So I think, I think one question that often comes up, and Shital alluded to it, Dr. Evita, that there's a focus on painless deliveries, and therefore it is assumed that there is a implicit assumption that natural birth is very painful. But is there any evidence which says one or the other is better for the health of the women? Is natural childbirth better, or is childbirth with intervention better?
Yeah. Thank you, Aparna. I have to admit to you and the audience, when I was in England training to pick up my qualification there, that was the first time I actually saw a woman be, given an epidural, and she had a beautiful painless labor and birth. And I was absolutely gobsmacked. And I said, when I come back to India, I must offer this to all our women. And so, didn't forget that. And in 1997, we began to offer epidurals to our mothers in labor. And I took great pride because the anesthetist group that we had offered a 24/7 service, and it was across the board to everybody. The woman who couldn't pay for the services to the woman who could pay, because pain was, common. And I took great pride in the fact that 78% of our mothers were on epidural, and our labor wards were very quiet. And I thought, that's the best obstetric service we were providing. But about 15 years ago, or let's say 12 years ago, the light bulb popped in my head when I realized that we were heavily interventional. And I had lost that whole, somewhere in my journey, I forgot that women could birth, women's bodies, they had the ability to birth. And why were we getting so interventional? So I began to reflect, and that's the time when I also got into midwifery. So my whole view on birthing changed. And I realized that, yes, there is pain in labor. But when you prepare women and you've got other options that don't demand pharmacological agents, then women can handle pain. And research has shown, and we saw it in our own mothers, when you give an epidural, the risk of an assisted birth, that is, you may use an instrument to actually help her birth. And then I discovered the joy, the feeling of accomplishment in a woman who's healthy, allowed to birth naturally, supported by midwives in a lovely environment. She does it without any need for pharmacology or epidurals. And the fact that she recovers so beautifully, it's just a whole positive birth experience. So 80% of mothers are healthy. And if given the right knowledge, prepared for labor and pain, offered these choices, supported by midwives and a birth companion in an environment that believes in this, you will find that your need for epidurals comes down. And that's what happened in our hospitals. It's around 30%, from 78 to drop to 30. So is it safer, natural birth? Yes. I would put my money on natural birth. As an obstetrician, I would say this with absolute conviction. But of course, you need to select the mothers. There are some mothers who may not want it natural, who may have started saying, I'd like to be, I don't want anything. But at some point, they may want it. And that's where you make that judgment call. You talk to the mother, and the odd mother feels she needs it. She gets her moment of rest, then she picks up her energy and then enjoys the rest of her journey. That's
right. Shital, do you want to add anything to that?
I think it's really important what Dr. Evita said, that preparing a mother for the labor, these are right.
You need to hold your mic closer.
You need to come closer.
Yeah.
You kind of come and go.
Gadgets. So, no, I totally agree that I think preparing the mother is really important, because there's a lot of fear attached to the process of labor.
She's frozen.
Yeah. So I think we'll come back to her. Maybe we'll move to the next question with you, Dr. Evita. I think basically she was saying that, the fear,
when you prepare
women need
the
to
woman,
be prepared.
yes,
For.
yes.
Yeah. So, you talk of midwife. I know that there's now talk of doulas. There's also sometimes the term used of birth companion. What are the differences between each of these, a doula, a birth educator, a midwife, a birth companion?
Thank you, Aparna, because I still battle with this even today. It's interesting when you use the word midwife. So many people will always talk about the traditional birth attendant that existed. Like probably my grandmother would have been helped by a midwife, and when she birthed at home. So I have to keep saying we're talking about a midwife, and we use the word professional midwife just to be able to distinguish, today when we use the word midwife, it means she is an accountable healthcare professional, trained to global standards, very competent, highly skilled, because she's got 2 lives in her hands. Okay. And she believes, the heart of midwifery rests on the very, very firm belief that pregnancy, labor, and birth are natural events in a woman's life. And, they become experts in normality. They take care of women who are healthy, who have no medical complications, and they recognize problems very early so they can refer or do whatever is required and then ask for help where needed. That's why countries that have invested in midwives have reduced maternal deaths and morbidity. So a midwife is an accountable healthcare professional. So you're very safe in her hands. A doula is a non-medical person, and she undergoes training. There are various organizations that certify you. And she's there to provide emotional, psychological support, and she's an advocate for the woman. Some couples, like husbands, especially with the first time to be parents, are nervous. So they could do with the presence of a doula who's there. She doesn't get involved at all in any medical side, but she's there. She massages, she helps the woman adopt certain positions, she helps her with exercises, but she's just an amazing comfort to have.
Right.
We've been dealing with doulas and we see the amazing effect they have on women. What was the other thing you asked me? A birth partner?
Educator, yes. And birth companion.
A birth companion, that's the woman's choice. She can choose whoever she wants. Most times they would choose the father of the child. Sometimes if he's not available, then whoever they want. But it would be good for the birth partner to be involved in those preparation classes so they understand their roles.
Right.
Childbirth educator. Today you've got various schools. You've got the Lamas, you've got Kappa, which is more popular in India. And you go through a course, you're certified, and you have to run through some hoops to be able to reach that status of being a childbirth educator. And I think they are a wonderful group of people. I suspect someone becomes a childbirth educator because they feel passionate about what they do. And they play a huge role in preparing women. Yeah.
Okay. But one of the things that we talked of at the beginning is that childbirth, often there is a lot of fear around it. There's a lot of anxiety around it. Again, in both your experiences, what are the factors that contribute to the anxiety, both before, during, and sometimes even after pregnancy?
Shital would probably like to.
Sorry, I got knocked out earlier. So I come across,
Can you come closer to the mic to speak up?
Yeah. So I find that a lot of people get a lot of mixed information, which tends to be the problem. Their information is unvetted. It's coming from the WhatsApp university or from these mommy groups. So, my advice would be to source the information that you're getting, make sure it's, coming from a reputed source, be it a website or a book, and do some homework yourself instead of just, asking people for advice. The other thing that we see a lot nowadays is the confusion whether we should follow our old traditional methods or then we should try the modern Western way of doing things. For example, in our own old traditions, a simple meal, to start off babies with is just like a khichdi, right? Which is just dal and rice. So, and nowadays people are doing, quinoa khichdi's and things like that. It's not sustainable. It's not easy in the pocket, Try to make it simple. If you want to fortify your khichdi, just add some veggies to it, right? It's a simple thing like that. And again, because in the urban cities, we have nuclear families, sometimes there's a lack of that maternal support, either the mother or the mother-in-law who can come in and guide the new mom. So the nannies and the maids that we have tend to be still unskilled, untrained. So we need, somebody to guide the new moms sometimes. And I think all of these issues can be easily solved just by having proper antenatal, courses or classes or some sort of care counseling that can happen during the pregnancy itself.
Right. Thank you. Thank you, Dr. Shital. Dr. Evita, do you want to add?
Yeah, I agree with what Shital has said, but the fears I do feel that women who are pregnant go through, and particularly the first time mothers, the fear of pain, because that's the most, that's the biggest bugbear. And therefore, it's so important that they are taught how to look at labor and birth, and even the language that we use, we sort of tend to call them waves rather than pain. And they use visualization, and they sort of, most people are very comfortable when you look at it as the sea, the waves that come and go, because contractions do happen like that. But I also believe, Aparna, women are scared because majority of our women across our country birth alone. And that's a huge fear. And I can't understand why we do that, because it's a basic human right for every woman to have a birth companion.
Right.
And yet we deny her that. And I think that would be one of the biggest fears after pain. So the easiest thing is to let her have a birth companion, and I think that's hard. And the third area is the fear of not being heard. The woman goes with certain expectations, but nobody has asked her, well, how would you like your birth to be? Nobody has even asked her, would you like your baby to be on your chest? Have you heard of skin to skin? She may have fears about being cut, the episiotomy, which we know today is not required. But yet there are doctors who continue to snip for every first-time mother when there's enough evidence that you don't have to do it. And the woman may have read about it, as Shital says, she's done her homework, but she's birthing in an environment where her caregiver does not believe in that.
Right.
So, there's all this tremendous fear of, that's why I feel respectful care is all about that, Aparna.
Yeah. And often, even if they do manage to bring it up, if they feel that they are kind of empowered is the wrong word, but they do want to be empowered and they bring it up, I think it's often dismissed as something that's just a fad, or something that is just something, as Shital says, or you've just read it in a mom's group, or you read it in a WhatsApp group, etc. So often I think the healthcare system, members of the healthcare system dismiss the requests or even the conversations that a mother would like to, or a pregnant woman would like to have.
I would always tell mothers, go back. I would give them sites to read. And I say, please read. And next time when you come, write down your list of questions. And, because I think it's so important, even in an antenatal clinic, to ask them, do you have any questions?
Right.
And that just gives them so much comfort. Yeah.
Right. There's also a lot of, increasingly, we are also hearing of women facing challenges in breastfeeding. So, Shital, as a lactation counselor, what is it that, you are observing? And again, what are the factors behind that?
Most challenges, I think, are common in the first-time moms, essentially. And women who have either like a complicated birth or a difficult labor. They tend to be the ones who have the most issues. The most important period for breastfeeding tends to be the first, hour, and then the first few days. But that is the time when most moms, if you're not prepared, can really, sort of mess up the whole system in itself. So while they're in the hospital itself, those first 3 days, before going in, they need to prepare themselves. And that's why some sort of antenatal, counseling, these classes, some sessions, are important, because then you go in prepared, you know exactly what's going to happen, you know what to expect, right? So then you're not going to get into latching issues and nipple issues. You're not worried about milk production. You know, these are just basic things that do make a lot of difference to the mom, and this causes a lot of stress. And stress, as we know, is actually a hormone. You know, it produces a hormone called cortisol, and what it does is it causes a physiological setback to the entire cycle of milk production.
Right.
So again, when stress comes into play, then you know, you're also going to see that it affects the bonding between the mom and the baby. It's going to cause anxiety. It's going to cause mental health issues for you know, the newborn as well as the new mom in itself.
Right.
So all of these things, along with, you know, some support and knowledge about how to care for a newborn, I think are the most common issues that I come across. And at least I feel that 90% of them would be just laid to rest if, you know, we can just, you know, somebody needs to just be able to talk to the mom and provide her support and allay a lot of these, you know, stress related issues.
Right. So the one question I have is the challenges faced on breastfeeding, are you seeing it more in a certain segment, you know, as in are women, the more elite urban, are they overthinking this, and are they the ones who are seeing more challenges in breastfeeding, or is it, are you seeing it across different stratas?
Yeah, I mean, definitely there are certain genuine challenges that definitely happen. You know, people could have like nipple issues and latching and toning issues with the baby themselves. But I think, yeah, with the elite women, you know, there does tend to be a lot more anxiety, stress, lack of, you know, support in nuclear families, like we were talking about. Um, and all of those factors maybe add to it. Again, like I was saying, you know, there's a lot of confusion between what to do. So with, you know, follow the modern method or stick to your old traditional things. Um, so that causes a lot of hesitation again as to who to approach to ask all these questions. We have to remember that, you know, the gynecologists and the pediatricians don't really have time for a newborn to address all of these day-to-day issues, right? So, and that is where, you know, either a doula, you know, your lactation counselor, and all of those people come into play. So it's important that you know that there are people out there who can help you, and that you should recognize the issues and be able to seek help.
Right. Dr. Evita, in your experience, what is the, you know, what are the critical factors to minimize these issues? And as Shital said, that some of these are bound to be there. I mean, some women are, you know, going to have certain issues, but if we had to look at how do we reduce the incidence of these issues, what are the key factors?
Aparna, again, I think we obstetricians need to reflect on this a lot. You know, earlier when we did, let's just take a cesarean, for example. You know, we do a cesarean, we show the baby to the mother, the baby goes away to the, you know, somewhere to the nursery because the mother is still being sutured up. Then she goes into a post-operative ward where she's in an air-conditioned environment for various reasons. So you can't bring the baby in because the baby may get hypothermia. And we had all kinds of reasons for separating mother and baby. And when I think of, you know, oh God, how horrible we were. We, you know, we just presumed this is the way it should be done because the mother has to recover and she wouldn't actually see her baby for a few hours. And that's when the first time she would breastfeed. So we were doing the wrong thing. What we do today is, even in the operation theater, the baby is born, the mother is given skin to skin and is encouraged to attempt breastfeeding. So
Right.
it just means us to understand that and make the effort to provide that support. When you birth a baby normally, vaginal birth, or even if you've applied an instrument, the baby is in good shape, put the baby straight away on the mother's chest. Encourage skin to skin. Get the baby to breastfeed within that 1 hour. I'm sure, Shital, you agree, it's that 1 hour that is so important. Then you've minimized these problems. The mother's so confident. This is what I'm talking about that happens during birth. But
Right.
antenatally, I agree with Shital. Those classes would help a lot.
Right.
And we've also got lactation counselors all over the hospital and a helpline 24/7, because then mothers need to be able to talk to somebody.
Correct.
I definitely know that we obstetricians are most times probably hopeless in terms of supporting women, unless it's an obstetrician herself who's been a mother, faced these issues, thinks differently, and is able to help.
Right.
But over the years, it looks like the lactation counselors have really been playing a huge role in helping mothers.
Right. Okay. And you both keep talking about antenatal education. What really should be a part of antenatal education? I mean, there are a bunch of classes now that some people have access to, not everyone. But what are the essentials of antenatal education?
Shital?
I do these antenatal classes myself, and it's not like a one-time session, so it does take place over a few weeks so that we don't overwhelm the mother with a lot of information in one go. But I do believe that we have to give the mother the right information. So I do give them a lot of medical information as well. So again, so that she's used to the medical terminology that, that will be used by her doctor. She can go and ask her doctor the right questions at the end of the day as well. So things like even the stages of pregnancy, how her body is going to change, the anatomy and the physiology of breastfeeding, let's say, how the hormones work, the nutrition and exercising that's going to take her along her entire journey, both post and pre. And post is equally important, right? Because post birth, then the mother needs to also put some time and effort into self-care, because we see that a lot of mental health issues like postpartum anxiety and postpartum depression can actually be minimized just by encouraging the mother to take some breaks and either do some form of exercise or take some time off for herself. And lastly, newborn care, how to care for your new baby on your own. Let's say if you have nobody else to help and support you. And I tend to do a little bit of first aid basics. So, things like what is good fever, when to report a fever, diarrhea and colic, and, small stuff like that. And then lastly, we also talk a lot about the birth plan, and that is what labor, the stages of labor again, what you should talk to your doctor before you, in your last trimester of pregnancy, as to the kind of hospital you want to be in. Okay. Ideally, you want to be in a hospital that has a neonatal ICU in case your baby support. When you go to a hospital, if you want to implement the no formula rule, you need to let your gynae and the hospital that you register at, let them know that ahead of time. Choose a pediatrician. Again, meet your pediatrician beforehand, and don't blindly just, get the hospital pediatrician, because the pediatrician for the rest of your baby's life. I mean, at least till the baby is an adult, right? Have a meeting with your pediatrician. So all of these things are just really important. If you've identified these people who are going to support you through this entire process, I think that again minimizes the stress and the anxieties, because then you know exactly who to call, who to reach out to, and hopefully these classes themselves will give you a lot of knowledge and essentially power to handle the
Right.
issues yourself. So I tell them that if you take these classes, hopefully you will not see me in the postpartum period, right? Because you will be able to deal with a lot of it yourself.
Right. Dr. Evita, from the perspective of the childbirth itself, what would the antenatal classes cover?
Yeah.
Or what should they?
Yeah. I think Shital has covered so much, but I'm going to just shift all of us into a public hospital in a district in Telangana. Okay. And there is, what's happening there is amazing, because we had trained 30 nurses as a pilot group into midwives. And we visited them. Now they've been practicing as midwives for the last 2 years. So about 4 weeks ago, I visited an area hospital just to see what's happening. And these midwives are taking antenatal classes for women in the district hospital. And it was amazing to see gym balls, to see rebozos, and teaching women how to handle pain of labor. So they're preparing them, getting them to do various exercises so they can be physically fit, and also slipping in some information about nutrition, and then getting them to decide who they'd like to have as a birth companion. So you can imagine my joy when I see a husband with a woman, telling them about birthing positions. So in a district hospital, women are birthing, squatting, lying down, side, standing. And to me, I think this kind of knowledge, the confidence with which these women enter the birthing rooms in a public hospital, being given privacy, a curtain being drawn, and they know that these are their rights. I think that's an important part of antenatal education from an obstetrician's point of view.
Correct. And you talked of some of these things, but I think so. There's a lot of stuff that floats around, right? We've talked of the confusion around additional information, etc. But really, what constitutes a healthy pregnancy? Because there's a lot of, in fact, in some sense, there's way too much information that goes around for at least a large percentage of women nowadays, right? And there's also, as Shital says, there's this constant conflict between what the doctor is telling you versus what your own family members may be telling you versus your various other friend circle will be telling you. But if you have to kind of, and there's, we can talk a little bit also on some of the common misconceptions, but what constitutes really a healthy pregnancy? Dr. Okay, Shital, you want to go first? Go ahead, Shital.
So I just want to say that, there is no tendency, that everybody can identify and say, okay, we all, so whatever one woman goes through, it doesn't necessarily mean that somebody else would go through the exact same thing. So people have to remember that when they're comparing notes, okay, I had vomiting and you didn't, and I gained so much weight and you didn't. So I think it's just essential that you make sure you do your scans and you do your checkups on time, so that if there are any issues, they will be identified earlier, they can be corrected. And staying again happy, to me, is very essential for a healthy pregnancy. Staying stress-free and just having a nice time. So I tell my, pregnant women patients this all the time. I said, this is your honeymoon period, because once the baby comes, your honeymoon is over. So enjoy this time.
I think, Aparna, yes. While we focus on the physical fitness, the antenatal visits and the medical tests and the scans, which are very important, I've come to believe, Aparna, that it's so important for that woman to be welcoming of this baby. So emotionally, psychologically, does she really want this baby? And if that is right, then what Shital says, the other things like mental health issues, I mean, relationship with her partner,
Right.
is there domestic violence? I mean, those are the other issues that would affect her, her attitude to this whole pregnancy. And that's the stress that we don't often speak of.
Correct.
Even mental health issues. I'm so anxious that we don't even, we're just scratching the surface. So when you're talking about a healthy pregnancy, I think these are areas that we also need to focus on.
Right.
Because if a mother steps into pregnancy without all these mental health issues and stress, then she's birthing the next generation with confidence. And she's better prepared emotionally, mentally to nurture that baby with confidence.
Right.
And between pregnancy and becoming a mother, that labor and birth experience, if it's a positive one, then she's made for life. But if she's had a traumatic experience because the staff have been rude, insensitive, she's had pain, she's been alone. Now you can imagine what that's going to do.
Right.
Apart from the maternal infant bonding, that's going to be screwed up also. So my definition of a healthy pregnancy is really a healthy mother, emotionally, psychologically, physically. Yeah.
And how much of that is, kind of important to get healthy before you even get pregnant?
Yeah, I think that is extremely important. And that's why pre-pregnancy counseling, pre-pregnant visit is so important. Because sometimes women are not aware that they have medical issues. And the other thing is a woman who's beyond a certain body mass index, when she gets pregnant, she's actually, her risk of morbidity and also death is increased. So I think it's so important to raise that awareness that women seek help even before they get pregnant.
Right. And because you talk of body mass index, I do want to bring up this point because often there's this assumption that, while it's the honeymoon period, it also means that the pregnant woman is expected to eat for, herself and a full adult pretty much. So if you want to, there is a lot of expectation increasingly of them needing to rest. So, if you want to kind of shed light on that.
Yeah, that's a myth. People think they have to eat for two, not at all. There are very, very clear guidelines depending on the body mass index that you start with. Then we know that you're allowed to put on only this amount of weight. So that's why we focus on physical activity and very, very healthy eating. I've often felt very sorry for women who are beyond a certain body mass index. It's almost that, they're not allowed to gain weight, really. They have to be very careful. So I think that's a whole myth. And we just need women to understand that they have to eat healthy and be physically fit. So there's a lot of exercise. Swimming is a beautiful exercise if people have the privilege to enjoy it. I've had women swim right up to 2 weeks before they set into labor. Absolutely a brilliant way of keeping fit. Yeah. Shital, I'm sure you'd like to add to that.
Yeah, I mean, just before she comes on, I think, and sorts her audio out, I think unfortunately swimming in India is still a privilege for most
Yes,
people.
it is a privilege.
one of the things that I wish there was more access to
Mm.
for a whole lot of conditions,
Yes.
to be honest.
Yes. Yeah.
Shital, so are you good to go? No?
Frozen.
I kind of lost connection
Yeah,
there
yeah.
again.
Okay, no, you came back just there. No?
Okay, sorry, what was the
No, so we
question?
were just talking about, you know, the importance of healthy pregnancy and what constitutes healthy pregnancy. Do you have anything that you would like to add there?
No, I think we talked about a lot of things. I just want to add that we really need to encourage women to speak to their doctors, and not be shy about it. Like Dr. Evita said, make notes, list down all the things. There's no such thing as a stupid question. So do that, even if you speak to the nurse outside your doctor's office, she'll be able to provide you with a lot of information as well. And a lot of doctors' offices now do have these counselors sitting in with them. So if you ask, you may realize that there is other support system within that clinic itself that you can seek help from. And it's important to just go ahead and do that. Even in rural areas, our government hospitals have trained nurses, who do provide you with the right kind of breastfeeding care, even if it's just the day that you get admitted, right? So at least ask for that, speak to the nurse the day you get admitted, and she'll be able to give you a lot of guidance, even if it's short term at that point.
Right.
And again, planning at the time of conception, again, very important, really gives you time to think about it. Make sure you get your checkup done at that point. Make sure you don't have any vitamin folic acid deficiencies. All of those we know can cause issues. So all of these things, I think, need to be done. We are now at a point where we do have access. Okay, if you just sort of reach out, you should be able to get it.
Right. And in terms of after childbirth, the immediate period after childbirth, are there any kind of, is there any advice that you would give to new mothers in terms of, staying healthy? And sometimes they're stressed about losing weight, sometimes they're tired. Should they, exercise? Should they rest? There seems to be a lot of confusion around that as well.
Yeah, I think that's again one of those things we talk about, during one of our antenatal classes, that how the mom can actually navigate her time with the baby, the newborn, scheduling, trying to schedule the newborn and trying to schedule your day is not easy. So if you can get help, please take it. If it's hired help, and if it's, somebody in your family who's willing to, just give you a break from time to time during the day, so you can, just go have a nice hot shower or take a nap. Make sure you're eating your meals properly, so the little things, and that will just make the whole experience a happy experience. And that is very important. I think a happy baby deserves a happy mother, so there are little things that you need to just do. Don't clog your day with trying to do too many things. Keep it simple, and try to just seek help when you need it. If you're not able to do something, if you think something is not working the way it should, then make sure you again seek help.
Right. Dr. Evita, we've talked about a lot of challenges. I don't think we've kind of gone deep enough into a lot, but we've covered, I think it's a vast topic. But really, how can, and this is not just for, the urban well-off mothers, but how can any mother or any woman kind of empower herself so that she can self-advocate, and how does she navigate this completely overwhelming hospital system that she needs to kind of feel confident and be able to engage with them, and so that she can demand, as you said, respectful care.
Yeah, that's a good question, Aparna, and a tough one also. I'm so aware of the need for change, and I'll start with us obstetricians. I think we need to be sensitized. We need to be educated. We need to have that light bulb moment in our heads and to stop and say that we need to change first our own attitude, understanding of birth, and listen to what women are talking. So we need to listen to women's voices. So it's a multi-pronged attack, if I may use the word. So one is change has to begin from the obstetric fraternity. The second is to talk about it, get women to be aware. So use every platform, because now mobiles are in every woman's hands.
Right.
So, WhatsApp messages, raise this, short videos, anything in languages that women can understand. Our work with the government and working in public facilities has reinforced my belief. You don't need to be in an urban setting. Knowledge is absorbed, and it's a right for women to know, every woman to. And the minute you tell women why you're doing something and why this is being done, and they just understand, and then they start talking to you. So I feel awareness is extremely important, using women themselves to be advocates.
Right.
Of course, I believe that once we also have midwifery as a very strong cadre in our country, there will be a whole change in maternity, in birthing rooms. Respect, compassion, competence will be back in most rooms wherever there are midwives. And then obstetricians will learn to understand that when we work with midwives as colleagues, it's the mother and her baby who ultimately gets the best care, because then we are working collaboratively, each one of us bringing our strength to that table, keeping the mother and the baby at the center.
Right.
So I just think it's using every channel to make women aware of their rights.
Right. Thank you. Thank you. Shital?
I think education is key, to a lot of these issues that we are seeing today. And we can easily, get rid of a lot of these by doing just simple things, simplifying everything as well. I think we have made our lives more complicated in the 21st century, and then it has just sort of brought on more undue stress and anxiety. So I think if we just simplify things, go back to the basics, and just provide people with the right information, it will sort of really remove a lot of these issues, both pre and postnatally.
Right. Okay. And okay. And so I think we've kind of covered what women should do, what obstetricians should do. Hopefully, we'll have a cadre of midwives large enough soon that we can support. Natural.
I mean, we used to have ayas, right? I think in the.
But these are, I think, more. So I guess it's a good point, Dr. Evita, to explain if there is a difference and how do you differentiate professional midwives from.
Because today I was just telling Aparna, when you use the word midwife, most people talk about, the traditional birth attendant, and they played a huge role. I mean, they helped because there was no other option. And even when you take the word midwife, it's an Anglo-Saxon word. It means with woman. And wherever women birthed, there were other women helping her. So, we're not surprised that women feel safe with midwives. So that whole ethos has to come back. And it'll come back. Absolutely. And it'll come back if we obstetricians step out of the arena.
Right.
And let the midwives take care of the healthy women, while we offer support and take care of the women with complications who need our focus and our help. So we're trained to do cesareans, we're trained to help women birth using instruments, we are trained to help make that decision as to when she needs intervention, So it's that whole collaborative work. If we can bring that into our hospitals, I think women will be happier. They'll get the best care that they need. They'll feel supported. And then we are privileged to be helping to birth the next generation in the best possible way we can. I don't know. I'm a dreamer. It's not a utopian dream. It will happen. And I'll do everything in my power to make that happen.
More power to you, and more power to, lactation counselors like Shital, who reduce the anxiety of young moms as well. I think thank you. I think the messages are quite clear that, it's important for various healthcare stakeholders to listen, communicate, educate women out there, and women to start planning their pregnancy and start getting healthy even before they get pregnant. I think that's increasingly becoming a bigger and bigger issue given the comorbidities that are coming up during pregnancies, which are not well planned and are not healthy. So I think that's important for all of us to recognize that, as WHO says, we need to act now and work towards safe and respectful care. And for women to make the most of the information out there, and we are in a
take charge of themselves.
Take charge of themselves, right? And seek out care and seek out as much as possible. And there are forums where you can clarify. There are helplines, as Dr. Evita said. So use resources as much as possible. So thank you, everyone. And thank you to the audience for listening.
Thank you
so much. Thank you for this privilege.
Thank you.
Yes,
thank you.
Thank you.
Yeah. Thank you, Dr. Evita. Thank you,